The Careful Classroom. My name is Erica Rivera, and today I'll be presenting about the prevention of eating disorders in early education. Eating disorders are serious, at times fatal illnesses that are characterized by a person's obsession with food, body weight, or body shape, and they result in severe disturbances to a person's eating behaviors. The most commonly known eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Eating disorders are detrimental to the social, psychological, emotional functioning, and development of an individual. They're often lifelong disorders and battles that develop around the age of adolescence. They result in medical complications that can include heart failure, kidney failure, malnutrition, and the loss of life. Unfortunately, those individuals that show symptoms and tendencies of eating disorders are very often undiagnosed. Of those who are diagnosed with an eating disorder, less than a third of those individuals seek treatment. Furthermore, those who do seek treatment are more likely to drop out than individuals with other psychiatric disorders. Even more concerning, intervention programs are producing low rates of symptom remission. Only 40 to 60% of participants show improvement after a year. Adolescents are particularly at high risk for the development of eating disorders, and is the most common age for the development of eating pathology, such as fasting, binging, and the intake of dietary supplements. Concerns regarding treatment programs, compounded with the serious medical consequences of eating disorders, makes prevention increasingly critical. Researchers agree that eating disorders are caused by an extremely complex interaction of factors. Perhaps the greatest contributing risk factor to eating pathology is body dissatisfaction. Body dissatisfaction is often caused by the internalization of the thin ideal. Vygotsky developed the sociocultural theory, which states that a culture's values and beliefs are transmitted to the next generation. Today, media suggests to adolescents that thin is the ideal body type, and those who do not fit the norm are valued less. Individuals suffering from eating disorders also report beginning dieting at a young age, experiencing weight-related teasing, and a lack of family support. Prevention programs aim to decrease the known risk factors of eating disorders, most often through the attempt to decrease body dissatisfaction in adolescents and increase their knowledge about nutrition and health. A number of prevention programs also attempt to challenge the thin ideal and its representation in media. Prevention programs such as the ones listed here have shown to increase body image and decrease unhealthy attempts at weight loss in young children and adolescents. Again, it's important to note that their success is attributed to the fact that they directly address risk factors of eating disorders in young children and adolescents. So how might a teacher address these risk factors in a classroom setting? Through purposeful planning, a teacher can emulate the prevention strategies in these professional programs. To prevent body dissatisfaction, schools need to provide a comprehensive health education curriculum that includes nutrition, physical activity, and eating disorder awareness. Students should be encouraged and provided time to take a critical look at media, analyze the business of advertisement, and question cultural ideals. These types of learning experiences incorporate a great deal of dialogue, and teachers should model respectful discussion for students. A strong classroom community is necessary to prevent weight-related teasing. Skills associated with the social and emotional development of young children, such as empathy and conflict resolution, need to be explicitly taught and integrated into curriculum. Educators should also incorporate the instruction of stress management skills, as stress has been known to be a contributing factor to the development of eating disorders. Not only is it important to educate the student, but it is also important to communicate with and educate the families and caregivers of children and young adolescents. Perhaps most importantly, classroom teachers who spend so much daily time with their students need to be educated on the risk factors and possible warning signs of eating disorders in young children. To be diligent is to be dedicated to the prevention of eating disorders in young children and adolescents, and the health problems that can occur in the later years of life. Thank you for your time.